Welcome to the NCD Alliance webinar. I will now pass it on to Katie Dang, CEO of the NCD Alliance.
Good morning or good afternoon, everybody, and welcome to this NCD Alliance webinar on the 4th of April. If we could go to the next slide. In terms of just a couple of housekeeping before we get into the agenda and our set of speakers for today. Many of you will have been involved in NCD Alliance webinars before, but just as a reminder, we have Q&As after each of the main agenda items, and in order to ask your question, please type it into the chat facility on your screen that you'll see in the left-hand corner. And then at each Q&A, we'll go to some of the questions that we've received during that segment. Secondly, just to say that we will be sharing a recording and the PowerPoint slides on our website after the webinar today. So for those of you who are unable to join us right now, you can log in and listen to it back at another time. So in terms of what we are covering today on our webinar, as you can imagine, a lot of activity going on around the 2018 UN High-Level meeting on NCDs, less than 6 months away now. So we'll have a focus on that. We'll also be including a few other updates related to the high-level meeting, including the upcoming WHO Global Dialogue on financing for NCDs that's happening in Copenhagen just next week, as well as an update and a recap from the UN Commission on the Status of Women, which happened last month in New York from an NCD perspective. Thirdly, this webinar we will focus on, will include a regional spotlight. We have a guest speaker, Dr. Anselm Hennes from PAHO, who's the NCD director there, to talk us through some of the progress and activities going on at the regional level in the Americas on NCDs, with a particular focus on multisectoral approaches for NCDs. Fourthly, obviously, we're now getting into the time when everyone is preparing for the World Health Assembly, which is taking place just next month in Geneva. So we'll be giving a bit of a brief overview of what we can be expecting at WHA this year. And then finally, we'll give a quick overview of UICC's World Cancer Congress, which is happening in October in Malaysia this year, including some of the NCD elements of that Congress. Next slide, please. In terms of our speakers today, from the NCD Alliance team, we have Priya Knaisen, based in New York, as well as Jessica Beagley, based in London. And as I said, really pleased to have our guest speaker, who is Dr. Anselm Hennes, who is the Director of the Department of NCDs and Mental Health at the Pan American Health Organization in DC. So very pleased to have Dr. Hennes with us today. So with no further ado, let me pass over to Priya, who will give an update to everybody on where we are in terms of preparations for the UN High-Level meeting. Over to you, Priya.
Thanks very much, Katie. If we could go ahead and move to the next slide. So I wanted to first give you an idea of where we are in the process leading up to the 2018 UN High-Level Meeting, or HLM, on NCDs. As you can see, we're just about halfway there. The process began with the WHO Global Conference on NCDs in Montevideo last October, and really kicked off with the release of the UN Secretary General's report on progress on NCDs since 2011 and 2014, which came out in early March of this year. The report really, as I said, kicked off this process, and after its publication, the initial zero draft of the modalities resolution was disseminated for negotiations among member states in New York. The modalities resolution sets out the logistics for the high-level meeting, such as the date, length, timing, participation, and themes. Looking ahead, we have next on this timeline the outcome document negotiations, followed by the publication of the report of the WHO Independent High-Level Commission on NCDs, an interactive hearing with member states, civil society, and other stakeholders, and then, of course, the high-level meeting itself. Next slide, please. So to give a little bit of information about the UN Secretary General's report, I think this one definitely took a very different tone than what we've seen in previous reports. Previously, they tend to be rather diplomatic. This one was quite direct. The report calls for bolder commitments and makes recommendations. And some of the key NCD Alliance campaign priorities are also reflected in the recommendations, such as the need for greater investment for NCDs and scaling up implementation of the WHO Best Bites for NCD prevention and control. There's also a call for fiscal measures such as taxation of tobacco, alcohol, and sugar-sweetened beverages. And the report is something that was quite different this time, was that it really highlighted some of the key barriers to progress in a separate table within the report itself, such as weak political action at the highest level and the consequent lack of policy coherence across government sectors, as well as insufficient integration of NCDs into national plans. So it's quite an interesting read, and in the slides that will be available on our website, the hyperlink to read the full report will be live. Next slide, please. So as mentioned, there are quite a few recommendations contained in the UN Secretary General's report. There are a few of them listed here. And each of the recommendations really calls upon member states as well as the UN system as a whole to deliver on these suggested recommendations. So the UN Secretary General's report is usually used as a starting point for the development of the outcome document of the high-level meeting. So I think it was really encouraging to see this report take on such a tone and really direct recommendations and address some of the key barriers to achieving the commitments that have already been set forth for NCDs. Next slide, please. So to go a little bit deeper into the process in the modalities resolution, again, this sets out the logistics for the HLM, and the final informal meetings and negotiations to agree the resolution took place last week in New York, the 26th and 27th. There was agreement on the date, which will be Thursday, the 27th of September of this year, which is really great as this is during the high-level week of the UN General Assembly. And this is something that we as civil society were really pushing for. Again, this helps ensure high-level attendance at the meeting itself, really gaining that political attention that we need for NCDs in New York and globally. The modalities resolution also set out the overall theme of the high-level meeting, which is listed there. So a focus on the scaling up of multi-stakeholder and multisectoral responses for NCDs within the context of the 2030 Agenda for Sustainable Development. And I think that's very important that we are using this opportunity of addressing NCDs within the SDG era to really highlight how action on NCDs can help deliver on some of the other sustainable development goals and vice versa. The modalities resolution also set forth the panel themes for two multi-stakeholder panels. One is looking at health system strengthening and financing, again within universal health coverage and looking at some of the best practices there. The other is looking at really the multisectoral, multi-stakeholder partnership and engagement opportunities to address NCDs. Next slide, please. One of the key advocacy points for us was to ensure that an interactive civil society hearing was agreed as part of the modalities resolution. So we're really pleased to see that this will be taking place. So there will be an interactive hearing between member states, UN agencies, civil society, parliamentarians, and other stakeholders, and this will take place before the end of July. And we'll have more information about when exactly this will take place in the coming weeks. The next steps, as you can see here, the agreed text will be sent to the UN Budgetary Committee for approval, and their next meeting is in early May. So until then, we will really be waiting for the Budgetary Committee to approve the modalities resolution before things such as the interactive hearing date to be set. And then the next piece in the road to the 2018 high-level meeting is the outcome document negotiations. So this will likely begin in May after the modalities are approved by the UN Budget Committee and continue through the end of July 2018. So this is a key time for advocacy with member states both in Capital, in New York, and Geneva to share some of the civil society priorities, and NCDA to help with the advocacy around the outcome document. We'll be producing a shadow outcome document to really guide our advocacy. Next slide. So as you can imagine, September is always a very busy time in New York. There's quite a lot happening this year, specifically kicking off the week with the Nelson Mandela Peace Summit, the Monday of the HighLevel Week. The official General Assembly debate opens on Tuesday, followed by the UN high-level meeting on tuberculosis, which will be on Wednesday, and the HLM on NCDs on Thursday. So this year will be the first year that there are two back-to-back high-level meetings on health, which we see as really an opportunity to advocate for this One Health approach and really highlight some of the shared challenges and shared solutions for addressing both TB and NCDs. Next slide, please. So I will briefly pass over to my colleague Jessica Beagley to cover the next couple of slides.
Hi, everybody. So just to give a little bit of background on the WHO Independent High-Level Commission, this was established back in October. It was announced at the WHO EMRO Regional Committee meeting, although the members weren't confirmed until February. And the purpose of this group is to ensure that the UN high-level meeting is a tipping point for the response and to operationalize commitments. It's got a 2-year lifespan, so it extends beyond the HLM itself. And in advance of the HLM, there'll be a report submitted to the WHO Director General in June. There are 20 high-level members, including no less than 5 co-chairs. Those 5 co-chairs include Tabaré Vázquez, President of Uruguay, Sanja Nishtar, familiar to many of us around the phone, and also the President of Finland, the President of Sri Lanka, and the Minister of Health of the Russian Federation. And we're very pleased that Katie Dane, our CEO, is also a member of the Commission. Next slide, please. In terms of progress to date, the first virtual meeting of the Commission took place on the 2nd of March. And then from the 21st to the 22nd of March, there was a technical consultation in Geneva. Attendance at this meeting went much wider than the Commissioners themselves, with a range of technical experts being asked to put forward innovative ideas. This would be one of the 5 key inputs for the Commission. And these 5 inputs overall are recommendations that were submitted by these experts in advance of the technical consultation, a short list of 24 recommendations that emerged from those discussions, which is currently being collated and hasn't yet been circulated, recommendations that were discussed at the technical consultations but that didn't make the shortlist, we understand, will still be considered by commissioners. Then there'll be recommendations from the commissioners themselves and the recommendations that were made in the UN Secretary General's report. These discussions in Geneva, we understand, were very, very broad. They went beyond the 4x4 response to NCDs. A strong focus throughout this process on innovative ideas. There is a recognition that it's not possible, there's no point in reinventing the wheel, but there is a need to focus on where the gaps currently are in the NCD response. On the 26th of March, there was a second meeting of the virtual commission, and commissioners agreed that recommendations should all be evidence-based, transformative, actionable, and innovative. Next slide, please. The timeline for the process of the high-level commission has been ever so slightly updated. You can see down the bottom of the diagram on this slide that the web-based consultation on the draft of the report of the commissioners will be from the 16th to the 20th of April. This is later than originally planned. But everything else remains on track. There'll be a technical briefing taking place during the World Health Assembly on the 21st of May in Geneva, and then the launch of the report will still take place on the 1st of June. And with that, I will pass back to Priya.
Thanks very much, Jess. Next slide, please. So along with the Independent High-Level Commission, in October, Dr. Tedros also established a WHO Civil Society Working Group on NCDs. There are 25 civil society representatives from across regions, diseases, and risk factors to really provide a broad perspective on NCDs. And the purpose of this group is to advise Dr. Tedros on the meaningful involvement of civil society and people living with NCDs in this upcoming HLM on NCDs, and to really help mobilize high-level attendance and establish a network of political champions for NCDs. Again, we see that high-level meeting taking place during the UN General Assembly Week is really an opportunity to encourage these political champions and heads of state and government to attend the high-level meeting. The working group is co-chaired by our CEO, Katie Dane, as well as Dr. Svetlana Axelrod, who's the Assistant Director General for NCDs and Mental Health at WHO. Next slide, please. So the first virtual meeting of the Civil Society Working Group took place on Wednesday, March 14th. And on this call, working group members agreed on 3 key outputs, which are laid out as follows, really to develop a short set of key messages and a narrative for all civil society to use to encourage high-level participation and mobilization around the high-level meeting, to mobilize civil society networks across and beyond health, and also to cultivate high-level political champions, including those on the WHO High-Level Commission and beyond, some of those names just mentioned. And then, of course, to share existing initiatives and opportunities for mobilization around the high-level meeting. The second virtual meeting will take place next week, so we will share more updates shortly. Next slide, please. So this slide really sets out the formal and informal process for the high-level meeting. The top, those reddish and blue color blocks on top are the formal inputs to the high-level meeting, really giving an idea of where we've come so far and where we have to go. Again, we're about halfway, so the modalities resolution has been agreed amongst member states, and we have a few more blocks to go before we reach the high-level meeting. Simultaneously, there is the process taking place within WHO, so things like the report from the Executive Board on NCDs and the midterm evaluation of the Global Coordination Mechanism, the launch of the Bloomberg Fiscal Policies Commission on NCDs, the upcoming dialogue on partnerships for financing for NCDs, which I'll discuss shortly, as well as the reports from WHA and the Independent High-Level Commission. So all of these various reports coming out from WHO and the different commissions will hopefully be used as input into the outcome document negotiations. Next slide, please. So in order to help mobilize civil society, again, the NCD Civil Society Network and beyond, NCDA conducted a consultation with our network and various other partners to arrive at a campaign that could really convey the sense of urgency and need for action on NCDs. And we recently launched this campaign around Enough, Our Health, Our Right Now. And this is really meant to convey the sense of injustice and need for urgent action, again, on NCDs. And this is translated from English, French, and Spanish. Next slide, please. So as part of the campaign on our website, and there will shortly be a dedicated campaign portal online, there are quite a few existing resources as well as forthcoming ones, including videos that can be used to explain the upcoming high-level meeting, various infographics and template letters, etc. And we will also be looking at some other key messaging and social media guides which are currently online. So I really encourage you to visit our website and to check out some of these resources that we have, as well as share any ideas that you might have for useful resources. And I will pause there for any questions.
Thanks, Priya and Jess. We've had one question around the civil society hearing that's going to be taking place in the lead up to the high-level meeting that you mentioned, Priya. Do we know what shape the interactive hearing related to the high-level meeting will take, in terms of the length, in terms of the format, who will be invited, those sorts of things?
Sure. So it will most likely be a one-day meeting in New York held at UN headquarters. And beyond that, we will know more once the modalities resolution is approved by the Budget Committee in early May. Most likely there will be an application process for civil society and other stakeholders to attend the hearing. But again, more information will come in the next few weeks.
Great. And I guess if it goes by anything, if it takes a similar shape to previous civil society hearings that we've been involved in, I think in terms of participation, what we've seen in the past is that participants have to be ECOSOC accredited, and it includes civil society across NGOs, CSOs, relevant private sector, and obviously our objective of some of these civil society hearings in the past has been that we obviously have an opportunity to share our views and perspectives on the high-level meeting outcomes. So as Priya mentioned earlier, the date of the civil society hearing is actually really important, because if the civil society hearing takes place too late, as in near the end of the outcome document negotiations, the whole point of it is kind of up for question, because it kind of comes across as a bit of a tick box exercise in a way. We want it to happen a lot earlier, so that then we as civil society have a chance to raise our perspectives and priorities for the intergovernmental outcome document negotiations. Thanks, Priya. We've had another question. We've had a question from Catherine Hartman in terms of the campaign. This message could work for any health subject, not only NCDs. So how could you better tailor it to the specificities of NCDs? I think Catherine's referring to the Enough campaign, Our Right to Our Health, Priya.
Yes, thanks very much for that question. So the hashtag in all of the social media messaging and in the toolkit, the hashtag is hashtag Enough NCDs. You're very right. Enough on its own can be used for many different things. And so the logo that we have there is meant to be put onto other materials and resources that explain the NCD perspective of this campaign. So really encourage you to refer to the guideline on our website.
Thanks, Priya. And just one other comment which Oystein kindly shared on the chat facility as well. He quite rightly pointed out that the technical consultation that was held in March, which feeds into the High-Level Commission, the report of that technical consultation is now available online. And so the link has been shared there. And just to say that the report includes some 28 recommendations from the group for the High-Level Commission to consider, really spanning a very broad set of issues, from empowerment and advocacy to accountability, to societal approaches to prevention, to health system strengthening and financing. So very, very broad, and lots of really good suggestions for bold and innovative ideas in there. Okay, I think we will keep moving because we haven't received any other questions, but as a reminder, please do put your question in at any point and we'll come back to them in the Q&A segments. So let me pass back to Priya to give some of the other global advocacy updates going on.
Thanks very much, Katie. Next slide, please. So in terms of some of the other non-high-level meeting-related advocacy taking place, just last month we had the annual Commission on the Status of Women take place in New York. The theme for this year was addressing challenges and opportunities in achieving gender equality and the empowerment of rural women and girls. So NCDA, together with the Women in NCDs Task Force, the Mission of Jamaica, and WHO convened an event during the first week of CSW, and really the focus was on the need for gender-responsive approaches to reach all women and girls, looking at opportunities to harness technology and mHealth to improve service delivery, as well as the importance of including the patient perspective and people living with NCDs. Other events included those with a focus on mental health and integration of NCDs and sexual and reproductive health services. The hyperlink for the NCDA statement on CSW will be live when the slides go online. Next slide, please. And looking ahead to next week, as I briefly mentioned, there will be a WHO Global Dialogue on financing for NCDs held in Copenhagen next week, the 9th through the 11th of April. The program is available online and will be a mix of plenary and parallel workshop sessions. And the aim of this dialogue is really to look at the current landscape of financing for NCDs, as well as potential sources of funding and resources, with a real focus on innovative partnerships and mechanisms for financing. NCDA will be leading on one session. The focus is the role of civil society in resource mobilization and holding governments to account. So we will be sharing updates from the dialogue next week via our Twitter account and newsletter for next week for those of you who are unable to join the discussions in person. The outcome of the dialogue will be a call to action that will most likely serve as input to the high-level meeting preparations, including the outcome document negotiations, as we mentioned before. And so we really hope that some good recommendations come out of the global dialogue. In the sidelines, while there are no official side events taking place during the upcoming dialogue on financing, there is a youth innovation lab in the sidelines, and several youth advocates from the NCD community have been accepted to attend, which is really exciting, and looking at some of the work that's being done on financing within health as well as for NCDs. So I will pause there for any questions.
Thank you, Priya. We don't seem to have received any questions at this point on the CSW or the Financing for NCDs conference. Just to say that we'll obviously keep everyone up to date on the outcomes of the financing conference, because as we all know, this has been a major challenge and bottleneck in the NCD response over the years. So real kudos to the government of Denmark to be hosting this conference. And we're hopeful that this will be the first of kind of many to come, as well as not just dialogues, but actually putting money where their mouth is in terms of actually investing in NCDs as a priority health and development issue. Thank you, Priya. We'll keep moving. Now, our next agenda item is we have a guest speaker, as I mentioned earlier, Dr. Anselm Hennis, who is the Director of the Department of NCDs and Mental Health at PAHO. Anselm has been a real long-standing champion of NCDs over the years, and I think it's fair to say that PAHO has really been ahead of the curve in responding to NCDs across the Americas. So really pleased that you could join us today, Dr. Hennis, and look forward to your presentation on multisectoral approaches for NCDs and their risk factors in the Americas. Over to you.
Morning. Thank you, Katie and colleagues from NCD Alliance, and thank you for all the participants who are in line with us now. We'll give you a little overview of some of the issues that we have picked up regarding multisectoral approaches for NCDs and their risk factors in the Americas. Next slide, please. Wonderful. This is the overview of the presentation. We're going to speak a little bit to the burden of the NCDs in the Americas, the mandates and commitments of multisectoral action on the NCDs, why we're doing this, what's our justification, presence of NCDs in national plans and NCD commissions in the Americas, and we'll speak to some of the ongoing multisectoral initiatives. Next slide, please. Now, as you all know, the NCDs are a major cause of mortality in the region of the Americas. There are a total of 6.5 million deaths annually in the Americas, and 80%, or 5.2 million, are caused by NCDs. Additionally, the number of premature deaths, in other words, 35% of all NCD-related deaths occur in persons aged 30 to 70 years in the Americas. So really a very tremendous morbidity and mortality caused by NCDs. Next slide, please. We're going to do a quick overview of some of the key risk factors, really just to highlight some of the issues in terms of what we need to focus on. Now, this slide shows the prevalence of current tobacco use among youth in the Americas. Overall prevalence of tobacco use is about 13%. It's very similar among adolescents, male and females, at about 13% in men and 12% in women. Some of our significant users are actually in countries like Jamaica, Mexico, Dominica, Argentina, etc. And one of the worrying trends that we're starting to see, which is exemplified by a handful of countries, particularly Chile, is that there's no reversal. So by and large, men tend to smoke more than women, particularly young men. But in countries like Chile and as well as Jamaica, and Jamaica is probably the leading country where we see this, there's a reversal. And so you can see that in Jamaica, 31% of adolescent women smoke as compared to about 25% of males. And that trend to feminization is of great concern. Next slide. In terms of elevated blood pressure, is another risk factor for NCDs. Overall prevalence in the Americas is higher in men at about 21% compared to 15% in women. I will point out that the majority of countries where there's a high prevalence of hypertension is actually in the Caribbean sub-region. But the pattern is quite consistent. Many more men than women are hypertensive. Next slide. Now regards overweight and obesity. And it is nothing that we should be proud of, but the Americas actually is one of the most obese regions in the world. The overall prevalence of obesity is slightly higher in men. Obesity or overweight is higher in men than women at about 63% versus 60%. Of note is that there's a pattern reversal, particularly in the non-Latin Caribbean as well as the Andean countries, where the prevalence of overweight and obesity is higher among women than men. And of course, as you all know, this is one of the major drivers for diabetes. Next slide, please. Another key risk factor is harmful use of alcohol, and we present data in terms of per capita consumption of alcohol in terms of liters of pure alcohol. And the top four countries really are Chile, Argentina, United States of America, and Canada, where per capita annual consumption is of the order of 9 to 10 liters of alcohol. But this is one of the risk factors that is of major concern. But I must point out that we are not able to make much progress in terms of reducing the overall per capita consumption of alcohol. Next slide, please. Now, what are the mandates for a multisectoral NCD response? The United Nations Political Declaration on NCDs of 2011, that being the first global meeting at the United Nations level, called for a whole of government and a whole of society approach to NCDs. The United Nations Outcome Document on NCDs at the first review in 2014 noted that NCDs and health really was a prime responsibility of governments, and they needed to engage NGOs, the private sector, and other sectors of society on NCDs. The World Health Organization Global Action Plan on NCDs 2013 to 2020 documented very specifically the need to strengthen national capacity, leadership, governance, and multisectoral action and partnerships. And in our region, the PAHO Regional Plan of Action NCDs again reiterates the need for multisectoral action with relevant sectors of government, society, and integration into development agendas. As we look forward now to the Sustainable Development Goals, it yet again calls for an integrated approach. There's an imperative to work across all sectors, which is embedded in the 2030 Agenda for Sustainable Development, and the integration and interlinkage of the 17 Sustainable Development Goals necessitates a whole of government and whole of society approach. And in fact, as stated by Priya in her presentation, really, as we speak to the upcoming high-level meeting on NCDs, multisectoral approaches will be a key theme in the plenary session. Next slide. We all know these, the global consensus, and in fact, by tackling the 8 or so risks and improving coverage of essential medicines and technologies, drug therapy, and counseling, the global commitment from all member states is that these will contribute to a 25% reduction in premature mortality caused by NCDs by 2025. And this is still the mandate under which we're working as international agencies. Next slide, please. Now, this is just again to reiterate the NCD Best Bites. And we spoke a little bit about some of the risk factors. And the objective of the Best Bites is to reduce tobacco use, harmful use of alcohol, to promote healthy diets and to promote physical activity. And clearly, there are very common themes in these which have been updated in the recent Appendix 3. But for tobacco, it requires that we increase laws and prices on tobacco products. We implement plain packaging and large graphic health warnings. There's banning of tobacco advertising, promotion, and sponsorship. Ban smoking in all indoor workplaces, public places, and in public transport, as well as warning about the harms of smoking tobacco and secondhand smoke, as well as supporting cessation programs. And these guidelines apply quite equally to reduction in harmful use of alcohol. Then, of course, there's promotion of healthy diet and physical activity. And then, of course, there's specific targets aimed at diabetes management, cardiovascular management, cancer prevention, particularly cervical cancer, as well as tackling chronic respiratory diseases. And I'm sure these are all well known to all of us present. So these are the NCD Best Bites that we are promoting to reduce the burden of NCDs and to reduce the burden of risk factors, because they're all essentially highly cost-effective interventions. Next slide. Now, how can we assure that these targets for NCDs can be achieved? As you said before, there are a number of time-bound commitments that governments have agreed to in the United Nations Outcome Document. And therefore, we're going to look specifically at areas where we all can engage and work together to reduce the burden of NCDs and risk factors. And this is one key area, is through the commitment of countries to develop NCD multisectoral plans and policies. Next slide, please. Now, these data are based on a country capacity survey which we conduct in the region of the Americas as part of our reporting on progress of countries. And this slide speaks to the status of multisectoral approaches to NCDs in the region of the Americas. Now, a total of 80% of our member states of 28 countries have incorporated NCDs into national development agendas. Nearly 90%, or 31 countries, have included NCDs in their national health plans. 57% of countries have NCDs or risk factor multisectoral plans, and 37% of countries have NCD national multisectoral commissions. And this is one of the ways that our countries can actually enshrine and include NCD strategies within the national health and development context. Next slide, please. Now, in terms of the 35 countries, 13 countries actually have national multisectoral commissions. And of course, the countries are listed here, as you can see. And it then gives a breakdown of the various sectors which participate in these NCD multisectoral commissions. Government agencies other than health participate in 92% of these commissions in the region. Fewer than half of the commissions include UN agencies, a total of 46%. Other international agencies, in other words, 30% of 4 countries include other international agencies other than UN agencies. Academia is included in 92% of all commissions. Non-governmental or civil society agencies are included in 92% of commissions. And the private sector is included in 85% of commissions. I will note, however, that one country which has not ratified the Framework Convention on Tobacco Control, includes the tobacco industry within the context of its National Multisectoral Commission, which is actually proscribed by the Framework Convention, because there should not be any inclusion of industry in terms of commissions that have a normative role. So that, of course, made a concern to us. But this slide gives you a breakdown of the various sectors that countries which have NCD commissions include in their commissions in the region. Next slide, please. This section now speaks to the multi-sectoral initiatives in the Americas. Let's go on to the next slide. I will reiterate a little bit about what was said about the Montevideo conference, which took place in 2017, which really was one of the early and initial events that contributes to the high-level meeting. I won't dwell on it too much, but really the goal was to highlight the critical links between reduction of premature deaths from NCDs and enhancing policy coherence across all areas that impact the governance, prevention, management, and surveillance of NCDs, which obviously means that you have to include civil society and a multi-sectoral approach. 5 heads of state participated, as well as many sectors of government, UN organizations, and of course, many non-state actors. Let's go on to the next slide. And just to reiterate again, the objectives were to reinvigorate political action with the aim of enabling health systems to respond more effectively to NCDs, to also promote the financing of the national NCD responses and international cooperation. And this is an area that's caused us great concern. And as stated by Katie and Priya, there's going to be another meeting next week in Copenhagen, again looking into sustainable financing for NCDs, because really NCDs is the major cause of ill health and premature death, which really adversely affects mankind and all economies and impacts development, has not received the level of financial commitment needed to reduce the burden. Also, this meeting reinforced the role of non-state actors and sought measures to address the negative impact of products and environmental factors harmful to health, and to strengthen the contribution and accountability of the private sector and other non-state actors. Let's go on to the next slide, please. Now I'm going to draw your attention to the Inter-American Task Force on NCDs. And this is one of the activities that is being developed in the region of the Americas. And it's a strategic alliance of inter-American organizations and associated institutions and agencies aimed at contributing to the prevention and control of NCDs and risk factors in the Americas. The membership of the Inter-American Task Force on NCDs is the Pan-American Health Organization, the Organization of American States, the World Bank, the Inter-American Development Bank, the Inter-American Institute for Cooperation and Agriculture, and Economic Commission for Latin America and the Caribbean. And this grouping was launched officially in June of 2015 at the Summit of the Americas that took place in Panama at the time. And its objectives are to support member states in strengthening national capacities for NCD policy and policies and programs, to seek synergies and harmonization among participating agencies and their relevant NCD-related activities and strategies, and to coordinate in terms of NCD multisectoral actions of related to global and regional initiatives. Next slide, please. So some of the activities that have been taking place. We have been working on NCD investment cases, justification for how to invest in NCDs to get the best return on investment. And this has been a partnership between PAHO, WHO, UNDP. We've carried out a series of investment cases in Barbados, Jamaica, and Peru. And we've also working with IDB, UNDP, and WHO and other experts to improve the investment case tools. And this is actually a very innovative area. So really, we're learning as we go along in terms of how to assess the investment and the return of investments for NCDs. We're also working with World Bank on terms of taxes for health, how to divert and structure tobacco taxation into the health sector to use the money to improve health. the Inter-American Development Bank has also advanced tobacco taxation as a public health strategy. We're also working on multisectoral policy dialogues to prevent obesity. Next slide, please. Now, we recently held a joint high-level session of the Permanent Council of the Organization of American States, as well as the Inter-American Council for Integral Development, and titled Progress, Partnerships, and a Way Forward for the Response to NCDs in the Americas. And really, we see PAHO is actually the public health arm of the Inter-American system through the OAS. But the OAS has tremendous capacity through its coordination of ministries of health, education, transport, economy, etc., to really be a game changer in the region of the Americas in terms of the sectors beyond health that drive the NCDs. So really, I will acknowledge the contribution of the Ambassador of Barbados, His Excellency Mr. Selwyn Hart, who took a lead role working with the chairs of CD as well as the Permanent Council to host in March a high-level joint meeting of the OAS. 30 member states participated, and the head of PAHO made a very clear statement that what's been achieved so far, the prevention of NCDs, is inadequate. And really, it requires tremendous political commitment to put people's health first, ahead of politics, ahead of profits and ahead of self-promotion. And really, this can only be achieved with multisectoral approaches, particularly as we look towards the Sustainable Development Goals. Next slide, please. Now, President Tabare Vasquez was not present in the flesh, but he actually shared with us a video of his vision, and he made the point that only united can we win this struggle. Only united can we defend the health of our people. Ambassador Hart invited his colleague ambassadors to work together on a resolution to be adopted on NCD prevention and control at the OAS General Assembly of this year. Next slide, please. And the other gentleman who took part was Sir Trevor Hassel of the Healthy Caribbean Coalition, who was a specially invited speaker and spoke to the role of civil society in terms of multisectoral collaboration and health. Now, in terms of other multisectoral collaborations in the region, on Pan American Health Organization, in collaboration with the WHO FCTC Secretariat, the Campaign for Tobacco-Free Kids, the American Cancer Society, Johns Hopkins, Bloomberg School of Public Health, University of Chicago, Illinois, and International Development Research Center from Canada IDRC, with the participation of the Inter-American Development Bank, IMF, and the World Bank Group, have been working in a number of ways to really develop evidence to counteract tobacco industry arguments against increasing taxes. As we know, if one is able to reduce tobacco consumption, that has a tremendous impact on health. But as gains are being made, we must not lose sight of the fact that these gains are not sustainable if we take our eye off the ball. And even though we've made tremendous gains in tobacco, the industry is fighting back. So do not consider that we've won the tobacco fight until there's zero availability or full elimination of tobacco. So countries have shown advances in their efforts to monitor the impact of tobacco taxes on decreased consumption and increased national revenue. There's also the need for other voices outside of the traditional sectors to include tobacco taxes in the agenda of fiscal policy makers. Quite often there's a tension within government. Ministries of Finance see taxes from tobacco as being an important contributor to their national economies. And there's always the fear that if one looks at the health issues and taxes tobacco too much, there may be a backlash in terms of funding for national economies. And the tobacco industry always has a number of very carefully designed arguments against increasing tobacco taxes. So I think the key message is that one is to continue to fight the good fight in the interest of public health first. And just to clarify also, the the arguments which are posited by the industry that are aimed at opposing and delaying increases in tobacco taxes, and they are frequently referred to as scare, in capital letters, SCARE, tactics on the part of the industry. And some of these issues that the industry raises in terms of the size of the illicit market trade in cigarettes has been very, very significant among others. But I think let me not spend too much time dwelling on this topic. Let's go on to the next slide. Thank you. Now, there's also been a recent sub-regional workshop on law on non-communicable diseases for Caribbean countries. Now, it is known, but perhaps not implemented enough, that the use of law can be a tremendously powerful tool in the prevention and control of NCDs. And focusing on the use of law to regulate NCD risk factors and defending measures from legal challenges is a very important tool that is largely unutilized. So therefore, there's recently a meeting in the Caribbean sub-region in February, which included ministers of health, ministries of justice, attorney general's offices, among others, and ministries of industry and commerce, as well as participation from the CARICOM, which is the umbrella governance group for the region, including the heads. And again, the whole idea was to highlight the need for regulation of NCD risk factors through the use of law. Next slide. Other multisectoral collaborations in the region have included partnerships on NCDs, which have expanded significantly in the region of the Americas, and they now include the Healthy Caribbean Coalition, which is well known to us all, as well as the Healthy Latin American Coalition, or CLAS. There are sub-regional multisectoral NCD policy dialogues aimed at promoting best practices on integrating NCD policies beyond the health sector. And some of the partnerships which are included are the Public Health Agency of Canada and sub-regional integration entities in South America, such as ORAS, Central America, Comisca, and the Caribbean. And some of these dialogues will promote multisectoral policies for the prevention and control of NCDs. But these are ongoing policy dialogues. Next slide. And I'm going to finish with this slide, really. And our perspective is that there's been tremendous progress with establishing NCD plans in the region of the Americas. It remains a challenge to engage sectors beyond health and to change policies and regulations in favor of supporting NCD prevention and control. There's need for more advocacy. We must sensitize stakeholders. We must get a multisectoral engagement beyond the health sector if we're to make the level of progress that's required. There must be continued promotion of all of government and all of society approaches to scale up NCD prevention efforts, because mainly the drivers for NCDs exist well beyond the health sector. As we prepare for the third high-level meeting on NCDs, with collaboration with many players, particularly you who are participating on the call, and players such as the NCD Alliance, it is a tremendous opportunity to accelerate the multisectoral NCD response. Thank you for your attention.
Thank you very much, Dr. Hennis, for that fantastic overview of everything that's going on in the Americas and with PAHO's great support in the region for NCDs. We haven't got any questions at the moment, but let me ask you a couple as a chair's prerogative. You were talking about earlier in your presentation the number of national multisectoral commissions for NCDs. I think you mentioned that there were 12. And it seems like quite a few of them are in the Caribbean. Could you say a little bit more about kind of some of the challenges that some of those national commissions face? Because I think from our own knowledge and experience, it's relatively straightforward to set a commission up, but it's actually the kind of long-term sustainability of that commission and how actually the different sectors are working together that's actually so much more of a challenge. So if you could share some insights, that would be great.
Yeah, thank you. Very, very good question. I think really there's no one-size-fits-all model for these commissions, number one. What we have seen also is that the success or the impact of commissions largely is driven by the leadership of the country and the leadership of the commissions, where you have a lot of political will to support what the commission wishes to do. So in other words, there have been commissions which are at the level of the president's office or the prime minister's office, or you have very, very dynamic leaders of commissions. These commissions tend to be the commissions that tend to manifest the greatest degree of success. Another challenge that we tend to see with commissions is that when there's a change of governance, commissions often go into bid. So I've been to countries where there's been a tremendously significant launch of a national commission, and then there's a change in government. And with the change in political leadership, the commission dies. So I think one has to find ways to think about commissions beyond the political leadership of a country at a given time, so that there's sustainability irrespective, which is more of a challenge if you consider what I'm trying to achieve. I think also there's not a sense that of the particular value that commissions can bring to the NCD agenda. And I think we have to think of innovative ways to get countries to recognize how valuable commissions potentially can be. So over to you, Katie.
Great, thank you. We've got a kind of a comment/question come through. It's from Lena from WHO on the UN Decade of Action on Nutrition, which is from 2016 to 2025, which has a really strong focus on ending malnutrition in all its forms, so not just undernutrition and hunger and stunting, but also kind of obesity and diet-related NCDs. And we know that obviously in the Americas region, Brazil and Ecuador have been some of the leaders behind really kind of rolling out the Decade of Action on Nutrition. How is kind of PAHO taking forward the Decade of Action in the region?
Right. Well, I mean, it's one of our priorities. As you know, we are all part of WHO, and we are very pleased that Brazil is the first to really sign on to the Decade of Action and commit right out there. But that's definitely one of our very definite strategic agendas, and we work very closely with the member states. And as you said already, we have 2 member states on board at a very significant level, but that's all part of our work plan in the region.
Great, thanks. And one other question. Obviously, as you kind of alluded to in your presentation, there's a number of real champion countries across the Americas for NCDs. Obviously, CARICOM has been a long-standing kind of political champion, and now we're seeing the likes of Tiberi Vasquez and Argentina and Brazil and Mexico and others really stepping up to the plate. What's your kind of expectation of heads of government and heads of state attendance from the region at the high-level meeting in September?
You asked me a very interesting question, Katie, and I think the answer to the question is only in retrospect, but we certainly are doing our utmost to mobilize leaders to attend the high-level meeting. Our OAS meeting recently with the OAS, the joint high-level meeting, again was to emphasize to the ambassadors the importance of political commitment to make things happen. As you know, the whole NCD movement to the global level was actually catalyzed largely by the Port of Spain Declaration, which took place in the Caribbean in 2007. So our region has always been very committed to NCDs, and I think we're doing our utmost to working with the member states to have tremendous political participation. And that's pointed out, I think, by Priya, the placement of the high-level meeting at NCDs during the week when after the high-level meeting on TV creates the opportunity for political leaders to be present at the United Nations meeting in New York. And we really hope that this will have the presence of the political leadership that's required to highlight the importance of this topic. But we're doing our utmost to make sure there's political participation at the highest level.
Great. And one other question, Dr. Hennis, and then we'll let you go. You mentioned at the end of your presentation the importance of partnerships with civil society, and you mentioned the Healthy Caribbean Coalition and the Healthy Latin America Coalition class. Could you say a little bit more about kind of how PAHO works with civil society at the regional level?
Yeah, the reality is, I mean, we work really quite hand in hand. So in other words, many of the meetings, webinars, information exchange, participation in our meetings, etc., we really see civil society has been some of our key players. So we work very, very closely with them and collaborate in terms of information exchange, face-to-face meetings, virtual meetings, and we're as engaged as we can possibly be in working collaboratively with civil society. So, for example, there's a meeting of the Healthy Carbohydrate Coalition coming up very, very shortly as one of the preparatory meetings for the high-level meeting. We'll be playing a role there again. We play a very close role of class. We play roles with many professional agencies and organizations. And within the dictates of defense agreement framework of engagement with non-state actors, we will also collaborate or coordinate with sectors beyond civil society as appropriate to the mandates of WHO.
Great. And we've had one final question that's just come in from Maxime from FCA. Could you say a little bit more about the tobacco use prevalence in countries like Chile and Jamaica? For example, when did women start using tobacco products more than men, and which factors could perhaps justify this state?
That's actually a very good question. It's a topic that worries us significantly. And what we think it seems to be, and it tends to be adolescents, it tends to be advertising aimed specifically more at women than men. So part of the branding, for example, light, and that it's okay to smoke and so forth, a part of the messaging that comes through that is targeting women very, very specifically. And so the whole issue in terms of warnings on tobacco packages, trying to make sure there's single presentation, are some of the strategies that must be implemented to reverse this trend. Over.
Great. Thank you, Dr. Hennis. Thank you so much for joining us today for the presentation, and we will move on to our next agenda item. But thanks very much for joining us today.
Thank you.
Okay, so moving on to the next agenda item. And just before we do that, I wanted to acknowledge a comment that we'd also received from a colleague in Bangladesh to give us an update that Bangladesh is actually currently drafting a multisectoral action plan on NCDs that will be finalised in April, and there will be a high-level multisectoral committee on NCD prevention, which is actually being proposed. And the Ministry of Health and Family Welfare will be the president of this committee. So a really interesting example there, and obviously please do keep us up to date of any developments, whether it's national NCD plans being developed or commissions in your country. We're always interested to hear of lessons learned and success stories. So let me pass back to Jessica Beagley from the NCD Alliance to give you a run-through of what we can expect from the World Health Assembly in a month or so's time. Jess.
Hi everybody, thanks for bearing with us this far. Hard act to follow, but I'm the last speaker on this call now, so I'll round up relatively quickly. Just to look forward a little bit to the 71st World Health Assembly. Could I have the next slide, please? So it's taking place from the 21st to the 26th of May, as usual in Geneva. And this year is the 70th anniversary of WHO, and there'll be a number of extra events taking place around the World Health Assembly, one of which I'll talk about on the next slide. But also worth noting that all side events inside the Palais this year will conform to the theme of Health for All, Commit to Universal Health Coverage. So that's slightly different to the usual. Some of the papers that I'm speaking about on this slide are already available on the WHO website. You can see the link at the bottom of the page, and NCDA has also set up a dedicated web page, so you can check that for updates too. There's no indication at the moment of which items will be discussed at which point in the week, but as I said, some of the papers are available. In terms of the most relevant agenda items for the NCD response, there is of course a discussion on the 2018 high-level meeting on NCDs and also on the high-level meeting on TB, which will be following as well. The 13th General Programme of Work is due to be approved, and it's worth noting that the updated targets and indicator framework is also available online as of the beginning of March. The draft Global Action Plan on Physical Activity is due to be discussed, and there'll be a resolution on that. Health, environment and climate change, we're really pleased to see this carry through from the EB, the first time that WHO has expanded its health and environment discussions beyond air pollution alone, which is fantastic. Then there'll be a discussion on the global strategy for women's, children and adolescents' health, which we'll be engaging with as usual. And under maternal, infant and young child nutrition, it's well worth noting that there'll be a dedicated paper on safeguarding against possible conflicts of interest in nutrition programs, so very relevant for a lot of people around the phone. As part of the discussions on mHealth, there'll be a resolution tabled by India. And finally, there'll be discussions on rheumatic heart disease and rheumatic fever, which I'm sure anybody part of the WHF membership network will be interested in. Next slide, please. In terms of side events, of course, the official agenda begins on the 21st, but things are kicking off way beforehand. On the 20th of May, there is a public event entitled Walk the Talk, the Health for All Challenge. It's aimed at all ages and ability, and there'll be a 3-kilometre, 5-kilometre and 8-kilometre route around Geneva, and you can follow that link there for more information. NCDA will actually be active even before the 20th of May. We've got a training program for people living with NCDs taking place on the 17th and the 18th of May as part of the Our Views, Our Voices initiative, and also some training for the alliances that are involved in our SEED program. That's on the 19th and 20th. Some of the countries involved in that will be Kenya, Mozambique, Egypt, India, Vietnam, the Philippines, Ghana, Nigeria, and Myanmar. Finally, making it into the official WHA week, and it's worth noting that I'm only mentioning side events on this slide, which are open to a wide audience and have got their titles confirmed. There are many, many others already in the pipeline, and we will, as usual, be producing our WHA calendar, and that will be online shortly. So on the 21st of May, in the morning, there's a side event on driving novel partnerships throughout the NCD life cycle, looking at approaches to prevent and treat respiratory and cardiovascular disease in LMICs, and that's hosted by AstraZeneca. On the 21st, most likely at lunchtime, there's a side event linked to the WHO Independent High-Level Commission, which I already mentioned. And then that evening is NCDA's main side event, and that will be linked to our HLM campaign priorities, and the title is Setting the Bar High for the 2018 UN High-Level Meeting on NCDs. Two events to mention taking place on the 22nd of May, one by IDF on nutrition and one on NCD prevention and adolescence by a range of co-hosts. And as I mentioned before, there are many, many more in the pipeline, including one by WHF on RHD action, for which the details are to be confirmed, and one by the Broadband Commission on mHealth. But looking forward to learning more and more about those as they emerge. Could I have the next slide, please? Moving from Geneva in May to Kuala Lumpur in October, we've got the World Cancer Congress coming up from the 1st to the 4th of October. Next slide, please. Of course, hosted by UICC. And we're really glad for the third time that there'll be a dedicated NCD program. I'm very grateful to UICC for the work that they do in promoting NCDs. Really demonstrates the relevance of dialogue across disease communities, and we really encourage members of the NCD community to attend. The early bird rate is open until the end of June. Some of the topics that will be discussed include the HLM and the Financing Conference, of course, tobacco control in particular, but also a wider approach to the commercial determinants of health, universal health coverage, a person-centered response, and engaging people living with NCDs. I won't go through all of these session titles individually now, but the full NCD program is online on the World Cancer Congress website for your reference if you'd like to look. Next slide, please. As part of the NCD program, it's also the third time that we'll be holding an NCD cafe. These are small, highly interactive sessions. It's a forum for rapid-fire discussion and debate. And then also be an opportunity, in addition to the sessions listed on this page, to meet some of the plenary speakers that UICC is currently securing, and they're always of an incredibly high standard, so we look forward to providing an opportunity to discuss things with them in more detail. Next slide, please. That's all from me. We're slightly ahead of schedule, and there's some final time for Q&A if anyone's got any questions.
Thanks very much, Jess. So side events, there will obviously be a lot of different side events on NCDs this year we're expecting, and as Jess said, we'll be sending around our usual calendar of events within the next week. So look out for that as a useful resource. And we will also be doing our next webinar prior to the World Health Assembly, so at the beginning of May, when we will be able to update you in much more detail on the agenda items and the papers that will then have been published, and obviously our advocacy priorities and asks during WHA, so obviously look out for that one. We don't have any questions or comments coming through, so I suggest we finish the webinar early for a change. Thank everybody, all of our speakers for joining us today on this webinar, particularly Dr. Hennes as our guest speaker from PAHO. Thank you everyone for joining, and look forward to having you on the next webinar at the beginning of May for a WHA in-depth brief. Thanks very much. Goodbye.
This does conclude today's webinar. We thank you for your participation.